Imagine lying on a cold operating table, your heart racing, and the surgeon telling you that the only way forward is to put you completely under full general anesthesia. For most people, that sounds routine. But if you are over 65, that single decision could quietly change your life forever. Not because of the surgery itself, but because of what the anesthesia does to your aging brain, your heart, your lungs, and your ability to simply remember who you are the next morning. What if I told you that in thousands of operating rooms around the world, doctors are quietly shifting away from that old model, and that softer, gentler alternatives are not only available for seniors, but in many cases are actually safer and more effective? Today we are going to talk about something that most patients never think to ask about, something that your surgeon may not bring up unless you do, and something that could genuinely protect your health, your mind, and your independence as you age. Stay with me, because this information could one day be the most important thing you bring into a hospital with you. Let us begin by understanding why this conversation matters so much, specifically for older adults. The human body at 65 is not the same as it was at 35, and this is not a judgment, it is simply biology. As we age, every major organ system begins to slow down its processing. The liver, which is responsible for breaking down drugs and medications, becomes less efficient. The kidneys, which filter those broken down substances out of the body, also begin to lose function. The brain, remarkably, becomes more sensitive to sedative agents, meaning it takes a smaller dose to produce a much larger effect in an older person compared to a younger one. And the cardiovascular system, which must maintain stable blood pressure throughout any procedure, becomes less adaptable, less elastic, and more vulnerable to sudden changes. When you layer general anesthesia on top of all of those age-related changes, the risks compound in ways that many patients and even some physicians underestimate. This is why the concept of a softer, more targeted approach to anesthesia in elderly patients is not just a trend, it is a medically sound response to the reality of aging physiology. Now, one of the most important things to understand here is what general anesthesia actually does to the body. General anesthesia works by essentially shutting down consciousness across the entire central nervous system. Drugs are delivered usually through a combination of intravenous medications and inhaled gases that suppress brain activity to the point where the patient feels nothing, breathes with the help of a machine, and has no awareness of what is happening. This is, of course, life-saving in complex surgeries. No one is suggesting that you skip anesthesia for open heart surgery or major abdominal procedures. But here is the key insight. A significant number of procedures performed on seniors, hip replacements, knee surgeries, hernia repairs, certain gynecological or urological procedures, even some cardiac interventions can be performed under a much less aggressive form of sedation, and when they are, the outcomes are often measurably better. One of the most well-documented risks of general anesthesia in older adults is something called postoperative cognitive dysfunction, or POCD. This is a condition where patients experience noticeable declines in memory, attention, and mental processing speed after a surgical procedure involving general anesthesia. In younger adults, POCD is usually temporary and resolves within days or weeks, but in patients over 65, and particularly those over 75, the decline can persist for months. In some cases, especially in patients who are already at the early stages of cognitive decline, it can accelerate into something resembling dementia. Multiple studies have found that the incidence of significant cognitive impairment following major surgery with general anesthesia in elderly patients ranges anywhere from 10 to 40%, depending on the procedure, the patient's baseline health, and the duration of anesthesia. That is not a small number. That is potentially tens of millions of people globally who are walking out of hospitals with diminished mental function that they did not have when they walked in. So what are the softer alternatives? Let us walk through them carefully, because there are several distinct approaches, each suited to different types of procedures and different patient profiles. The first and perhaps most commonly used alternative is regional anesthesia. Regional anesthesia works by blocking nerve signals in a specific part of the body rather than shutting down the entire central nervous system. The two most familiar forms are spinal anesthesia and epidural anesthesia. In spinal anesthesia, a small amount of local anesthetic is injected into the fluid surrounding the spinal cord, numbing everything below a certain level of the body while the patient remains awake or lightly sedated. In epidural anesthesia, a catheter is placed near the spine and medication is delivered continuously throughout the procedure, providing sustained pain relief. These techniques have been used for decades in childbirth, but their use in elderly surgical patients has expanded dramatically as the evidence for their safety in this population has grown. For hip fracture surgeries, for example, research published in major anesthesiology journals has consistently shown that spinal anesthesia is associated with lower rates of postoperative confusion, shorter hospital stays, and reduced mortality compared to general anesthesia. Closely related to regional anesthesia is the concept of nerve blocks. A nerve block involves injecting local anesthetic near a specific nerve or group of nerves that supply sensation to the surgical area. With the help of ultrasound guidance, anesthesiologists can now visualize nerves in real time and deliver medication with extraordinary precision. A femoral nerve block, for example, can numb the entire front of the thigh and the knee, making it possible to perform knee replacement surgery with the patient awake or under very mild sedation. A brachial plexus block can numb the entire arm and shoulder. Nerve blocks are particularly valuable in elderly patients because they reduce or eliminate the need for opioid pain medications both during and after surgery, and opioids in elderly patients carry their own serious risks, including confusion, falls, respiratory depression, and dependency. This brings us to another soft solution that is transforming surgical care for older adults, the concept of monitored anesthesia care, often abbreviated as MAC-A. Monitored anesthesia care is not full general anesthesia, and it is not purely local anesthesia either. It sits in a nuanced middle ground. Under MAC-ing, the patient receives a carefully titrated combination of sedatives and analgesics medications to reduce anxiety and awareness, and medications to blunt pain while maintaining their own airway and breathing spontaneously. The anesthesiologist monitors the patient continuously and adjusts the medication in real time based on how the patient is responding. For many minor to moderate surgical procedures, biopsies, colonoscopies, cataract surgeries, minor orthopedic work, MAC provides excellent comfort without the physiological burden of full general anesthesia. Patients typically recover faster, experience less nausea, have clearer heads upon waking, and are able to eat and drink much sooner after the procedure. There is also an important concept that has emerged in the field of geriatric anesthesia called the multimodal analgesia approach. Rather than relying on a single powerful drug to manage pain and sedation, anesthesiologists using this model combine smaller doses of multiple medications, each targeting a different pain pathway. This might include a local anesthetic injected at the surgical site, a low-dose non-steroidal anti-inflammatory drug, a small amount of acetaminophen delivered intravenously, perhaps a nerve block, and a modest dose of sedation. By spreading the workload across multiple systems, the dose of any single drug, especially opioids and powerful sedatives, is dramatically reduced. This approach has become a cornerstone of what is known as enhanced recovery after surgery protocols, and in elderly patients it has been associated with fewer complications, less cognitive disturbance, and dramatically improved postoperative experiences. Now, it is worth spending a moment on what patients and families can actually do with this information, because knowledge without action is only half the equation. The most important step any senior or their caregiver can take before any surgical procedure is to have a direct, specific conversation with both the surgeon and the anesthesiologist about anesthesia options. Do not wait for them to bring it up. Ask directly, is general anesthesia necessary for this procedure, or is regional anesthesia or monitored anesthesia care an option? Ask what the risks of each approach are for someone of your age and health profile. Ask whether a nerve block will be used to manage postoperative pain so that opioid use can be minimized. These questions are entirely appropriate, and any competent medical team will welcome them. If you feel dismissed or that your concerns are not being taken seriously, that is important information too. You are entitled to seek a second opinion before any elective procedure. Another critical piece of preparation is medication disclosure. Many older adults take a complex array of daily medications: blood pressure drugs, anticoagulants, diabetes medications, diuretics, psychiatric medications, supplements, and herbal remedies. Several of these can interact dangerously with anesthetic agents. Blood thinners, for example, may need to be paused before certain regional techniques. Some herbal supplements like ginkgo biloba and garlic extract have significant anticoagulant properties of their own. The anesthesiologist needs a complete, accurate picture of everything entering your body before they can make the safest plan. Bring a written list to every preoperative appointment. And be completely honest, there is no such thing as an irrelevant medication when it comes to anesthesia planning. It is also important to understand the role of preoperative assessment in optimizing anesthetic outcomes for elderly patients. Many hospitals now have dedicated perioperative care clinics specifically for older patients. These clinics evaluate not just the immediate medical condition, but also cognitive baseline, functional status, nutritional state, and social support, all factors that profoundly influence how an elderly patient recovers from surgery and anesthesia. If your hospital offers such an assessment, request it. If they do not, ask your primary care physician to coordinate a thorough preoperative evaluation. Going into surgery well-nourished, physically prepared and cognitively assessed provides the anesthesia team with the information they need to tailor their approach optimally. And what about emergency situations where there truly is no time to discuss alternatives? This is where advanced planning becomes invaluable. Having a clearly documented conversation with your physician about your anesthesia preferences before any emergency arises, and recording those preferences in your medical file or health directive can guide the surgical team even when you are not able to advocate for yourself in the moment. It is part of the broader picture of aging gracefully and maintaining agency over your own healthcare. One more thing that deserves mention is the evolving role of technology in making soft anesthesia solutions safer and more accessible. Tools like processed electroencephalogram monitoring, commonly called BIS monitoring, allow anesthesiologists to measure the depth of sedation in real time by analyzing brainwave activity. This means that for elderly patients who receive even modest sedation, the team can ensure they are not going deeper than necessary, a safeguard that was simply not available a generation ago. Similarly, the widespread adoption of ultrasound-guided nerve blocks has made regional techniques faster, more accurate and safer than ever before. The field of anesthesiology is genuinely evolving in the direction of less being more, particularly for vulnerable populations like the elderly, and that is cause for real optimism. What we have covered today represents a shift in thinking that is spreading across the best hospitals and surgical centers in the world, a shift toward recognizing that the goal of anesthesia in elderly patients is not just unconsciousness and pain control, but preservation of brain function, rapid recovery and protection of overall quality of life. The old default of general anesthesia for everyone, regardless of age and risk, is giving way to a more thoughtful, individualized model that treats the senior patient not as a smaller adult, but as someone with a distinct and deserving physiology. That shift saves lives, protects minds, and allows older adults to return to their lives after surgery with the dignity and clarity they deserve. So to bring everything together, the aging body processes anesthesia drugs differently, and general anesthesia in elderly patients carries real, documented risks including postoperative cognitive dysfunction, prolonged recovery, and increased vulnerability to complications. Safer alternatives exist and are increasingly available, including spinal and epidural anesthesia, ultrasound-guided nerve blocks, monitored anesthesia care, and multimodal pain management strategies. As a patient or caregiver, you have both the right and the responsibility to ask about these options, to disclose all medications, to request preoperative evaluation, and to plan ahead wherever possible. If this video helped you or someone you love understand these choices more clearly, please take a moment to like it, share it with a family member or friend who might be facing surgery, and subscribe to the channel so you never miss content that could genuinely change your health decisions. Drop a comment below and tell me what health topic do you want to explore next. Your question might become our next video.